Well, Lenore Madu is here, our health correspondent for In Focus. Again, welcome. We have some very interesting information for us on autism.
Yes, indeed. April 2nd, rather, is World Autism Day, and today we look at this condition. Every 20 minutes, a child is diagnosed with autism, and as Jacqueline London reports, the sooner doctors find autism, the sooner children can be helped.
Why don't you do some re-bowling?
Tanner Kraft seems like any other 11-year-old. But Tanner isn't like most boys his age. He has autism, a developmental disorder that affects 1 in every 150 kids.
For me, it's hard to connect with him sometimes.
Tanner's mom, Tanya, wants to know if her little girl, Addie, will also develop autism.
Tanner was a challenge and is a challenge, but wouldn't trade it for the world, and she's been wonderful.
Siblings are at a 15% greater risk of being autistic. Diagnosis is based on behavioral tests, so that rarely happens before age 2. Researchers at Washington University in St. Louis hope to help diagnose this disability much earlier, even in infants.
We're just terrible at identifying them at 6 months and even 12 months, and so we really need something that's more like a laboratory test.
Child psychologist Kelly Bateran is testing siblings of autistic children using MRI scans and a technique called diffusion tensor imaging.
We know that there are going to be changes very early in brain development that will be important in terms of the development of autism.
Nikki Burkhead has 3 children. Her oldest, Luke, has autism. Ryder is her youngest and is getting ready to take the scan. She's already noticed the difference between the 2 brothers.
Ryder's babbling and saying some words already at a year, so we're hopeful. My gut feeling is that he's just fine.
Researchers are looking at the structure of the brain, the development of white and gray matter, and the development of the hippocampus. They hope this work will lead to earlier diagnosis.
We do think we'll be able to predict who will go on to develop autism and perhaps how severe the symptoms will be.
Once they know who's at risk, they can begin treatment months, even years earlier.
If you're able to intervene very early, the brain seems to have more ability to adapt and change.
Although Tanner has a tough time with change, hopefully this test will prove his baby sister won't have to deal with his same diagnosis. I'm Jacqueline London reporting.
And joining us via phone from Cameroon, Douala, is Kedi Anne. She's the Director of Communication of Centre Orchide, a center that helps children with autism in Cameroon. Kedi Anne, welcome to the program.
Well, thank you. Good morning.
Good morning. Listen, in the United States, statistics show that, for the past 10 years, there has been an increase of children with autism. Tell us about the situation in your part of the world, in Cameroon. Are there many children with autism?
Yeah, we can say that there are many children with autism because for 2 years, Centre Orchide has been organizing sensitization for autism. And this 2 past year, we have diagnosed 577 families with children suffering from autism. So we think that's a great number.
Now, you personally have a brother who lives with autism. One of the challenges that we've heard a lot about is the fact that it is difficult to diagnose this condition in Africa. How was he able to receive the diagnosis?
We found it out very lately, like he was 10 years old. For 10 years, we didn't exactly know what he had. We just tried to handle it for ourselves. And we finally got to find a psychologist who was able to diagnose it and to give a name to the illness, which was it was a big relief for us to know exactly what he has and to be able to know now how to help him better. So
now,
that's the real problem in Cameroon.
Okay, yeah, of course, now that you know that he has autism, what kind of resources are available there to take care of him and other children with autism in your country?
Before the center, there were not really real structures for children suffering from autism. You had some centers like 2 or 3, but which are more like daycare, but and a private center. So there's no institutional policy for autism, and people just try to do what they can to handle the children. There's not really something.
Now, you work with Centre Orchide, which is a center that obviously deals with children with autism. Tell us about what kind of help you are able to provide the children.
At the Centre Orchide, we use a well-known, how they call it, a well-known kind of treatment, psychological treatment, which is the ABA, which was created in the United States, and which is focused on helping individually the children to ameliorate their behavior. They have like much difficulties and comportamental behavior of much difficulties of behavior, and the center tries to give them programs to let them evolve and to be able to communicate better and to be more in the society.
Okay, well, that's all the time we have today. Thank you so much for joining us, and good luck in your work.
Thank you.
So that's autism in Africa. It is an issue indeed, but a lot of people still are not aware of it. So.
And that is the sad part. I mean, not having the ability to diagnose it in good time, and sometimes not having the kind of resources that you need.
Absolutely.
It is a sad affair.
Absolutely.
Before you go, Lenore, when you were researching this, were you surprised at the extent of autism in Africa? I mean,
Yes.
she said 577 families. That's quite high.
It is very high, and that's one of the reasons why we need to bring up more awareness about this condition, because in some societies, people still don't know about it. So.
Thank you so much, Lenore Madu, always with very vital information. Please look out for her every Tuesday and Thursday right here on In Focus.
And for more information on this stories, go to voanews.com/TV to Africa.